Hi, everyone. Hope people will come back. But I was asked by Bill specifically to focus on the high school arena, which is an interesting question because one of the big challenges that we have from a policy perspective, looking at sort of the history of policy regulation, and I was asked to focus specifically on schools. For those of you who don't know my work, I do I'm all things policy, and I study policies from across the country at the state, local school district, and county municipal levels on pretty much every topic related to obesity you can imagine. But I've spent a lot of time in this school policy space, and the high school arena is probably the least regulated arena before we had success with USDA in recent years and Congress in recent years related to smart snacks and certainly school meals. So for those of you who are not familiar, and I have to provide a little context here, I think I got the slides to Bill Sunday night, I think. So when I was doing these slides, I really was very nervous about what was about to happen in Congress this week relative to school foods and school meals and the smart snack standards, which regulate food sold outside of the meal program in schools. So I was very nervous when I was putting this all together because there were lots of unknowns. And I have to say that, at least as of Monday, sugars haven't been touched yet with rollbacks from Congress. So right now we're just sort of hopefully waiting to see if anything changes. So this slide is still relevant. I wasn't sure when I sent the slide off that it would still be relevant, but it still is. So right now we have a federal standard from the U.S. Department of Agriculture that regulates the sale of foods outside of school meals. And I highlighted in this particular slide sort of the specific standards related to sugars. And as you can see here, it's this issue, Bill, that you were talking about this morning. It's this issue of total weight. It's not dealing with specific free sugars or added sugars. It's not the 10% threshold. It's a much higher threshold. They do restrict beverages to water. Unflavored, low-fat, or fat-free milk. They do allow flavored milks. This was a big political issue, but it was allowed. And then they allow 100% juices. And then at the high school level, they allow diet sodas with or without caffeine, and they do have some portion size limits. A couple of things to note here, and one of the reasons why I still am concerned about whether anything's going to change on this on the federal level is if we remove the smart snack standards, even with all the wonderful efforts of Carter and his colleagues at Voices for Healthy Kids and everyone else around the country who's been working in this space, we actually know from our research that there are really only about a handful of states and very few districts who actually, on their own, in the body of their law, meet the this threshold in their policies. So if we actually roll back federal standards, most of the states and districts that actually meet smart snack standards do so by embedding by reference to the federal standard. They say, we follow the USDA standards, or they cite to the federal citation, but they actually don't include the content of the standards in their policies. So if we actually faced a situation where the sugar provisions were rolled back, we would have a real patchwork approach, which is where we were before the USDA standards took effect in 2014-15. And there'd be very few states and districts in this country that really had any strong regulations whatsoever relative to sugars. And I guess the question would be, is this even strong enough given the conversation that we've been having earlier today? I just want to show you a little data here. This is from new data that we have coming out from a grant that we have from USDA. And even though we have these federal standards, we do know from our research that implementation of school policies does tend to be greater in states and districts that actually have policies in place. You can have the federal overlay, but we know that implementation is not universal. And we do know that implementation, when it does happen, is more likely to happen when you have local policy occurring. Even if it's just policy that reinforces what's going on at the federal level, having that local policy, because that's what local school teachers and food service people refer to. They refer to their local policy. I also know from our research over the years that local district policies are stronger in states with stronger laws. So having groups like Voices for Healthy Kids advocating for these strong policies at the state level to complement and reinforce what's happening at the federal level is still critically important because districts then typically will follow and model what's happening at the state level. And that's really where they focus their implementation efforts. Earlier this morning, when Bill was originally presenting his initial slides, he talked a little bit about artificial sweeteners, and I didn't include it in the slide, but I did want to let you know there are actually only 2 states that ban artificial sweeteners in beverages, and that's Connecticut and Massachusetts. Being from Connecticut, I will give a shout out to my home state originally. And I don't know if it's a New England effect, because the only other state that really addresses this issue is Rhode Island. And they encourage restrictions on artificial sweeteners, but they don't really touch it. So there's a real disconnect in the policy world. And Pat and I encountered this in one of the IOM committees we were on together, where it was sort of a debate about whether we should touch this issue of artificial sweeteners. And from a policy perspective, it's a real challenge, just because of all the mixed evidence there, and the focus that we were dealing with was specifically on obesity. And so that's why we tended to focus particularly on sugary drinks. And most of the policies and most of the implementation where you see success is in the beverage area. And the reason why you see the most success and most of the policy language focused on beverages, it's a lot easier to regulate beverages than it is to regulate the sugar content in foods or to regulate the content of foods. So that's typically what we've seen over the years. Whoops, I'm missing a slide as well. So my evidence slide is actually missing. So I will just fortunately I brought my slide up so I can tell you what my evidence slide said. If there were a situation where policies at the federal level were rolled back, what we do know from our prior research before the USDA standards took effect is that you need to ensure that laws and policies are consistent across grade levels. What we typically have seen over the years is that policies are very strong in regulating food and beverage content at the elementary and middle school level, but once you get to high school, it's all, everything goes. And so the policy restrictions get much weaker over time. And so if students are going from a very controlled environment to a very uncontrolled environment, what do you think is going to happen? Their behaviors are very different once they get to that uncontrolled environment. So although we have these federal standards right now, a lot of states are still not doing a lot in the high school arena. And so if there were any rollbacks happening at the federal level, it would be a critical issue. The other thing that we saw prior to the USDA standards is that a lot of states regulated just soda and they didn't regulate other sugary drinks. And so what happens? Kids will substitute. And so that's why having strong standards, not just in taxation, but in school policy, that prohibit the sale of all sugary drinks, sports drinks included, and energy drinks included, really are critical, because if kids don't have access to soda, they just go and purchase everything else that they can. And so that's a real challenge. We do know from our research that school policies work in terms of changing the school food environment. There's not universal implementation, though, even with having federal standards in place. And so there's a lot of work that still needs to be done to really figure out and help to facilitate our understanding of what's going to move the dial enough to facilitate full implementation in the school level, particularly at the high school level. And we do also know from our work, Dan Tabor, who is the greatest postdoc in the history of mankind, I think, when he was working with me, we did a study that actually looked at the California standards before USDA and compared them to students in states, 14 states that didn't have any standards in this area. And we basically found that sugar consumption less sugar consumption in students in California, significantly less sugar consumption amongst students in California compared to students in states that actually did not regulate in this area. So policy really can make a difference. However, we also have seen over the years from our work, and all my citations were on this last slide, so I don't know what happened to that slide. But what we did see from our work over the years is that I just blanked out on what I was going to say. I apologize. Overall consumption. School policies are doing what they intended. They're changing what's happening in the school environment, but they can't affect the overall environment. So Pat and I were on this committee, Accelerating Progress in Obesity Prevention for IOM, and one of our key messages from the school sector was, schools are the heart of health, but they can't do it alone. And so my message for us today is, we need to look at schools as a critical intervention point and a population level intervention point, but if we're not talking about what's going going on in the broader community and the broader environment in terms of what kids are being exposed to, schools are not going to be able to handle this on their own, and they're not able to. We know from evidence about sort of access to corner stores and junk food in corner stores and sugary drinks and things like that, the marketing issue and all sorts of things. So there's lots of opportunities for complementing the work and the policy work that's happening in schools, but it can't be the only place to focus. And given the political environment we're in right now, I think the time is really important to make sure that we're very focused across the environmental spectrum and not just in one area. So thank you. I think I got cut off because I gave you a title slide. That must have counted as one of my slides, was my title slide.
Thank you, Jamie, and we're very sorry about the slide mix-up. But we do have time for a couple of questions. Go ahead, Kimber.
Jamie, what percentage, or do you even know, of high schools are open campus versus closed campus? Because regulations don't.
Yeah, so thanks for the question, Kimber. I don't know the actual percentage, and the best place for that data right now is probably coming, well, it's not even being continued anymore at the University of Michigan as part of the Youth Education Society study that was complement to Monitor the Future. The last data we have from that was from 13-14. The percentage is not as big as it used to, but we know for a fact that fast food outlets in particular will build around schools, high schools that have open campuses. So it's a very targeted sort of opportunity. The other problem that we have besides open campuses is what kids bring in from home, and you can't regulate that. So there's multiple challenges here. The most important messages in the school setting is to be consistent across locations of sale within the school environment, include a holistic approach, a comprehensive approach, so that you include the nutrition education, restrictions on marketing of junk foods in schools, along with the food and beverage restrictions, and promoting healthy options. Somebody else, hi.
So I'm really interested in the concept of positive deviance. Mm-hmm. And have you looked at what were the qualities in the environment in these two states or in some of the schools you've studied that really led to the acceptance of these policies and the implementation with fidelity?
So our policy research is national. I think the last day I was referring to was just California compared to 14 other states that didn't have any standards in place whatsoever. All the other states are in the middle. But we haven't actually, it's a really great question. We haven't had, our focus has typically been looking at the relationship between policy implementation and health outcomes. So we haven't looked at some of those factors, and I think that's a real gap because nobody's really sort of honed in on that. What's interesting is we know policies actually are stronger in the areas where they need it the most. We know that South Central region of the country, the district policies in particular, like Mississippi, Alabama, that area, they actually have some of the strongest policies. And when I've done some focus group work with school food service officials and school district officials in those states, when we asked them about competitive foods, they said, this is not our problem. Our problem is a lot of the other stuff that's going on because our kids can't afford to buy the competitive foods because they essentially have universal free and reduced price lunch participation and they can't buy the other stuff inside the school. So they're worried about other factors beyond just competitive foods in schools.